Hi, this is Dr. Kevin Smith, and thank you very much for checking out this video. And in this video, what we're going to talk to you about is about how you could have chronic knee pain, but the source of your problem could actually be coming from your back. Now, that's something that freaks people out, and they don't really understand why the problem could be coming from someplace other than the knee. And we're going to explain that to you right now. If you take a look at this chart right here, we have a chart of the spine and the tailbone, and then we have the nerves that come out of the spine. So the nerves that come out of the low back, they go down into the leg. And the nerves that come out of this part of the spine go down to control the muscles of the front and the back of the thigh, which controls the knee joint. So if you have any kind of problems with the nerves that feed the thigh and feed the knee joint, you're going to have weakness in the muscles, and that's going to cause your knee to become sloppy, and it's going to cause an instability, inflammation, stiffness, chronic pain, and a decrease in function. So one of the things we're going to talk about is where the nerves that come out of the spine right here, and why it's so important to take a look at the lower lumbar spine. So if you take a close-up shot right here, what we have is a model of some vertebrae from the lumbar spine. And what we have is a vertebrae that's separated by an intervertebral disc and then a vertebrae. This is the spinal cord, and then right here are the spinal nerves that branch off of the spinal cord itself. Think of this as like the trunk of the tree, and these are branches of the tree. The disc is there to separate the vertebrae to keep them from rubbing into each other and to make sure that there's no pressure on the delicate nerve. Bone is the hardest tissue in the body, and nerve is the softest tissue. So if you have anything that's misaligning this or causing stress or pressure on the nervous system, what that's going to do is it's going to disrupt the nerves that go down your spine. Everything starts right here in the middle, and then it goes down the leg, and that's why it can cause problems in your knee. Now what we have here is a model of a degenerated lower spine. So what we have here is vertebrae separated by the disc and then another vertebrae. But if you notice this one, notice all the bone spurs that have formed on the vertebrae, and then look at how worn down that the disc material is. So people that could be in their 4th or 5th or 6th decade of life or even older, what often happens is that they can develop a little bit of arthritis or degeneration in their lower spine that can invariably cause a problem down the neurokinetic chain, causing problems further downstream from the back. So one of the things that we have to do to help you is to evaluate you neurologically and structurally to find out where the root causes of your problem are coming from, and then fix them at the source, as opposed to the medical approach, which is just to give you drugs like narcotics or steroids or injections or send you to surgery. But those types of problems rarely, if ever, fix the root cause of the problem. That's why you're on a treadmill for the rest of your life, taking these toxic medicines and going under risky invasive surgeries. There is another way of fixing this problem. Just like there's more than one way to cook an egg, there's always more than one way to fix a health problem. My approach is to fix it at the neurological and the structural levels. My approach is safe, non-toxic, non-invasive, and it works. If you have any questions about your condition or your case, please visit us at www.pittsburghknee.com. And if you want to discuss your case directly with me, give me a call at 412-212-8880. Thank you very much for checking out this video.